We start with a few moments of observing our natural breath. We can sit comfortably. Allowing the weight of the body to be supported by the ground. We can make sure that we are on the center of our sitting bones, not too much to the front, not too much to the back. Imagining the spine gets longer and longer from the roots that are coming into the ground through the pelvis, all the way up to the crown of the head. And then delicately we can shift our awareness to our breath. Without changing anything, without creating anything. We can just observe the natural pattern as it is right now. Maybe we can sense the breath in the tip of our nostrils. Maybe we can sense the breath in our internal spaces, in the chest cavity, in the abdomen, or anywhere else. We let the breath be as it is. It's not obvious, but we really want to develop this ability just to listen, to observe, before we start playing with it or changing it. And then we can pull our attention to the area of the low abdomen. And we will practice 3 rounds of Kapalabhati. When this area of the very low abdomen is being pulled inside with every sharp exhalation. And in between the exhalations, we release and we allow the air to come in through our nostrils. The sound of the Kapalabhati comes through the nose. The throat is relaxed and quiet. And we can start quite slowly. So exhale all the air out. Inhale. And we start. Exhale, release. Inhale from the bottom up. We can stop for a moment and then exhale, allow the air to come out. And we can take a few moments to observe again our natural breathing. The next 2 rounds I will instruct without the break in between, but if we feel we prefer, we can have this break in between the rounds to observe again the natural breathing anytime. Exhale, inhale, and we start. Continue bringing this movement from a very low part of the abdomen, as if we want to touch the tailbone from within. Exhale, release. Inhale from the bottom up. Again, we can stop for a moment in the end of the inhalation and then softly release until the end of the exhalation, and we go maybe straight into another round. Inhale, and we start. Continue, keep the chest open and relaxed, keep the throat relaxed. In between every exhalation, we allow the air to come in. We can feel the air come in through the nostrils. And then release. Exhale. And inhale from the bottom up. We can stay as much as we feel comfortable with this breath retention. And whenever we feel, we exhale softly. Ujjayi. We keep our attention connected to the breath and we slightly contract the area of the throat so we can hear maybe the sound of the breath very, very gently, a bit like the sound of waves, of quiet waves. We can hear the friction of the air in the area of the throat. Both in the exhalations and in the inhalations. And we can have in mind maybe the movement of the diaphragm and the pelvic floor, or we can just shift our awareness to those areas and see if we can recognize the synchronized movement. With every inhalation, there is some expansion. also of the belly. And with every exhalation, the pelvic floor is engaged. The diaphragm goes back up. The sound of the breath is very present. It doesn't have to be loud, but only in a sense that we can hear it from within. And staying connected to the sound of the ujjayi, we can move towards the part of the asanas practice.